Hello and welcome to the award-winning Waterman Wellness, your pathway to health and wellness with local experts as your guides. I'm Jenna Kreger. We have a lot of helpful health news for you in this episode, including people who have wounds that just won't heal can receive specialized care that speeds up recovery. We'll show you. A local surgeon explains why advancements in a procedure to correct painful hernias has helped patients' outcomes. Plus, you'll find out how specialists are correcting arrhythmias and giving patients a better quality of life. First, we have news to share about advanced technology that will soon be available in Lake County to help patients in need of hip replacement. Orthopedic surgeons at Florida Hospital Waterman now have the Mako hip robotic arm assisted technology, which provides a new level of precision during hip arthroplasty procedures. Since 2012, the local surgeons have been using the Mako robotic arm for partial knee replacement surgeries.
Well, the data suggests that it helps improve outcomes in two ways. It helps to improve component alignment within the hip, which then helps improve gait, and it helps to preserve bone. We don't need to take as much bone from the patient to implant the hip with the Mako hip robotic application than you would do normally. So anytime we can save our patient's bone and improve our component placement, it improves overall outcomes. We have a proven track record with Mako Uni Knees. We've provided that service for our community for a number of years, and that technology helps our orthopedic surgeons do an outstanding job. We expect the Mako hip robotic arm to do the same thing. You know, Florida Hospital Waterman is high touch, high tech, and we want to make sure that we offer the latest in technology to our patients in Lake County.
You can learn more about advanced robotic-assisted technology available for orthopedic patients by visiting the website fhwatermanortho.com. Next, we move to the heart and an advanced procedure to help patients with a common and potentially dangerous cardiac condition known as arrhythmias or AFib. A Lake County electrophysiologist is especially excited about patient outcomes from a surgical procedure to correct these structural issues in the heart.
I had no idea, I had no symptoms at all. I was in Tennessee for my work up there, and it was time for my annual inspection on me. I went over to see my doctor, and he said, "You got an atrial flutter." So he said, "We're gonna get you on Coumadin right now." And he put me on Coumadin, and I said, "What's this for?" He said, "Got to thin your blood down because afraid you're going to get a blood clot and then you have a stroke or worse."
The Eustis man, who is an aviation mechanic, was referred to Dr. Miguel Bryce to correct the atrial flutter.
I would say it's a very common arrhythmia of the upper chambers of the heart. That is not a congenital disease. What it does is start perpetuating in a circuit that is going and going and going at around 300 beats per minute. And every 2 to 3 beats, one beat will go to the lower chamber.
And he said, with a heart, you have either electrical problems or plumbing problems. The plumbing problems is your veins and arteries and valves. And electrical is that little electric sense that you get in your heart. It has your heart, the muscles in your heart collapse and squeeze the blood from one chamber to another. And he said, part of your blood is just keep circulating in that part of your heart and don't never leave. And he said it could, cause a blood clot.
Dr. Bryce decided Tensfield would be a good candidate for a cardiac ablation.
Cardiac ablation is a procedure that is done through catheters that get advanced peripherally through the veins and sometimes through the arteries up to the heart. It's highly computerized, in which we can see, like in GPS, where the catheter is and where the current is going. After we identify the arrhythmia and identify what do we want to correct, then we can advance the proper ablation catheter, because all the other catheters I have on board are like the diagnostic part of it to find out, and those catheters will deliver energy. It's radio frequency energy that with contact with the tissue will modify the tissue, but it's damage of the tissue on purpose that we want. Subsequently, the arrhythmia get corrected.
And I said, well, what would you do if it was your dad? And he said, I'd go up the groin and obliterate. I said, just do it. And when the time came, came here to the hospital, and they went through the procedure. And after I woke up, he came around and he said it was a success and everything. You know, he said, did you ever have any chest pains? You know, did you ever feel like you were real tired? And I said, yeah, when I worked, you know, when I climb the ladder and trim the palm trees and stuff. But that, you always get tired. When I would be tired when I was 20. But I said, I never, just for no reason at all, felt tired or had any sweats or anything, and no pains in my chest. And I haven't had since. And I'm blessed.
You can learn more about the advanced treatments for arrhythmias and find a specialist at the website fhwatermanheart.com. In the past, a hernia diagnosis could mean a patient might face a long recovery from its treatment. We turn our focus to hernias and the surgical procedure that has advanced tremendously in recent years. Boris Mascarenhas, a surgeon in Tavares, says doctors aren't sure why patients get hernias, but they agree that the condition must be corrected.
A hernia happens when there's a weakness in the abdominal wall. So the insides then start protruding out through the weakness, or the defect as it's called. A hernia can contain fat, or it can actually contain part of the intestines or part of an organ on the inside. It usually presents as a swelling in the area concerned, a swelling which most of the time you're able to reduce by applying pressure to it, but most common symptom being pain. And the longer this goes on, there's a chance that the blood supply to the intestine can get affected. And if that goes beyond a certain level, you develop gangrene of that part of the intestine. And that is a surgical emergency and potentially life-threatening.
According to Dr. Mascarenhas, surgery to correct the hernia is the only way to correct the condition.
Hernia repairs essentially have evolved. There's a wider use of laparoscopic procedures in the repairs of hernias compared to the traditional open approach. There are advantages of the laparoscopic approach in that there are smaller incisions, less pain, quicker recovery. Essentially, the principles of a hernia repair is that you reduce the hernia first, and then the defect through which the hernia occurred is bridged with a mesh. And there are traditional types of meshes which are made from synthetic fibers. These are the ones used to reinforce the defect, but these traditionally are not anchored so that they come into contact with the intestine. We have had advances, as I said, in the laparoscopic technique. In addition to that, we've had improvements in the type of materials used for the mesh. And I think these two factors have resulted in a much easier experience for a patient undergoing hernia repair, as well as a much lower recurrence rate and also lower incidence of complications.
If you or a loved one suspects you have a hernia, you can find a specialist to discuss your options by visiting fhwaterman.com. It's time to take a break, but we'll have plenty more when Waterman Wellness continues. We'll introduce you to some hands-on programs that will help you and your loved ones live healthy lifestyles. Chef Fred is in the Con Recreation Health Center kitchen with a recipe that is ideal for adults and children who are on the go. And women who suffer from pelvic prolapse will learn about various treatments that may help relieve discomfort. You'll find additional health and wellness information in Waterman Wellness magazine. Visit watermanwellness.com to arrange for home delivery, and you'll also find a listing of the specialists featured in this month's episode. First, you might want to put these upcoming events on your personal calendar. We'll be right back. Welcome back to the award-winning Waterman Wellness, your pathway to healthy living with help from local experts. I'm Jenna Kreger. Our next story addresses a condition that many women experience as they age, and especially if they've given birth. It's called pelvic prolapse, and it can be the source of many symptoms that may include pelvic pressure, painful sexual intercourse, and urinary issues.
The bladder pushes on the anterior vaginal wall and it bulges out, like a hernia. The uterus can also bulge in the center and kind of telescope down and out, and there's different degrees. The rectum can push on the posterior vaginal wall down and out. A space between the cervical uterine attachment and the rectal area at the top of the vagina can balloon down. To treat prolapse, there's a couple things. Exercise. The second thing is they can use pessaries, which I tell my older patients that this happens to because it's mostly the older woman. It's kind of like wearing a diaphragm every day. So the pessaries come in a lot of different shapes and sizes, so we try to fit those. And then there's the surgical repairs, which is what a gynecologist like I do. And that can be including a hysterectomy. It can be a bladder lift. You hear people talk about, had my bladder tacked up. That's oftentimes what the older doctors would tell the patient that they were doing.
Women in Lake County can be referred to the Florida Hospital Waterman Rehab Institute, where therapists teach specialized exercises.
The pelvic floor is an internal layer of muscles. Think of it as a hammock which supports the bladder. For women, it supports the uterus. And we can strengthen those muscles by helping them isolate those muscles and not use what we call accessory muscles, not using their abdominals, not using their leg muscles, but focusing on strengthening those pelvic floor muscles. For women, a lot of times it's multiple childbirth or it's stress and trauma. By virtue of our license as a physical therapist and physical therapist assistant, we can treat those muscles. And so it's using biofeedback to help the patient retrain those muscles to do what they used to do automatically. They will have to do it, we tell them, the rest of their life in order to maintain it.
You can find a specialist to discuss symptoms you or your loved one might be having by visiting the website on your screen. Next, some people with chronic health conditions may find that they are susceptible to wounds that take a long time to heal. In fact, an estimated 5 million Americans suffer with a wound or sore that just won't get better. If not treated properly, a chronic wound can lead to dangerous complications. A team of specialists is available in Lake County who are dedicated to assisting patients through the healing process.
We see a number of different kinds of wounds. Those that originate from arterial insufficiency, venous insufficiency, lymphedema, burns, traumatic wounds, surgically created wounds. Because we're able to do it under, sometimes if required, sterile or aseptic technique. The nurses are highly trained in the different products that we use, so product selection is very important. We have a number of different products, highly specialized products such as living tissue grafts that we're able to provide. We offer a lot of debridement that has to take place in order to facilitate or stimulate wounds to start the healing cascade again. We first have to get the proper diagnosis of what the wound is and what is causing it and what other factors might be interfering with the wound healing process. That's probably 80 or 90% of the wound healing problem. If we can get that done, then through scientifically based medicine protocols, then we're able to properly diagnose, treat, and get the best results in the shortest amount of time.
You can learn more about the Wound Care and Hyperbaric Medicine Center at Florida Hospital Waterman by visiting the website on your screen. Next, we visit the Connery Creation Health Center kitchen, where Caroline Rowland and the Florida Hospital Waterman team are standing by with a recipe for a meal that you can take on the go.
It's about time to send the kids back to school, and getting out the door in the morning, always a challenge. Getting breakfast on the table, we know, can be impossible sometimes, but skipping breakfast, never a good option for your children. So today we have some easy recipes you can make in the morning. Right now we're joined with Florida Hospital Waterman Executive Chef Fred Sugar and registered dietitian Mara Gallo. Mara, tell me a little bit about what we're going to make.
Today we're going to make a simple smoothie recipe. It's easy, it's quick, your children can take it with you on the go. It has oatmeal, strawberries, lots of good seasonal fruit.
Great, so Chef Fred, tell me a little bit about what is in here.
Awesome. Today we have fresh strawberries, low-fat plain yogurt, cinnamon, oatmeal, ice cubes and water to make the consistency of the smoothie and give it good body and texture. And we'll be using a half a banana to further enhance that. So what we'll do is we'll start with 1/2 a banana. We'll take the lid off of the blender,
And if you don't like bananas or strawberries, can you substitute these?
Sure, you can substitute using either fresh fruit such as blueberries, mangoes. You could also use a frozen fruit, a frozen blueberry if fruits are out of season. So those are also very good options. So right now we'll take the strawberries and the bananas, we'll put those into the blender.
So Maura, there's a lot of good ingredients in this recipe that'll keep the kids full throughout the morning, right?
Definitely. We have some oatmeal, which is very high in fiber. We also have yogurt, which is high in protein. And then you combine the carbohydrate of the fruit, it makes a nice hearty breakfast.
And you were telling me a little bit about cinnamon. We have cinnamon in this recipe, not just tasty.
No, cinnamon is very good for your children's attention, and it can speed up their motor visual responses.
And what's neat about this recipe is it's just so quick and so easy. And the smoothie pops up, and we have a wonderful, nice bodied smoothie that we'll pour into the glass.
Looks delicious, Maura.
Thanks, Chef Fred.
Cheers.
If you'd like the strawberry banana oat smoothie recipe, visit watermanwellness.com. Making the commitment to live healthier can be difficult, but what if you had help? The Conry Creation Health Center is offering a number of classes for the public in the coming months to help you become fit for life. Beginning September 7th, you can learn to maximize your intellectual and emotional intelligence during the Optimize Your Brain program. The 6-session class will be held Wednesday evenings and the cost is $55. Enjoy 2 classes in 1 with Fitness for Life. The 8-session course helps you combine a physical activity program with nutritional components. Fitness for Life is offered at 2 different times. The cost is $50 and that includes materials. The 5-week Diabetes Self-Management class teaches how to manage blood sugar, medications, exercise, and meals. The course costs $35 and includes all materials. Looking for healthy recipes for you and your family? Join the Yum Yum Club Cooking School. 3 classes are scheduled beginning September 13th. You can attend just 1 or all. It's $35 per class or $95 if you attend all 3. The cost includes food, recipes, and even an apron. And you can improve your memory by attending the Super Noggin class. It's fitness for your brain. Super Noggin will be held on Thursdays beginning October 6th. This 8-session course costs $50. Visit ConryCreationHealth.com for more information on all of these upcoming classes and to register. We hope you've enjoyed this month's episode of Waterman Wellness, your pathway to healthy living with help from local experts. Be sure to watch for the September episode right here on Lake Sumter TV for some of the following stories. A local hospital is the first in Lake County to offer radiation therapy specifically for prostate cancer patients. You'll find out about how local specialists are teaming up with therapists to help patients with Parkinson's disease. And you'll find out how some Lake County residents spent their summer vacation improving the lives of others. To learn more about the experts featured in this program, please visit watermanwellness.com. Until next time, I'm Jenna Kreger for the award-winning Waterman Wellness.